In this section, we're going to be looking at the family and family treatment. When we're looking at the family, the first thing we're going to be talking about is the assessment screening. In order to do an assessment screening for the family, we need to do a combination of individual interviews with the family as well as joint interviews with the family. So in the individual interviews, a few things that we're going to be looking for, we have to screen to make sure there's no intimate partner violence, no child maltreatment, if there are any co-occurring mental disorders, what's the level of the violence and safety in the family. And if any of these come up, then we'll need to be making referrals before going ahead to do family treatment, either to find a different area to work with the family or to have supports in place. The other thing that we're going to be looking at is how each family member views substance use. And depending on, how they feel, that will also impact treatment. So what are their core beliefs? What are their motivations to change? Do they have a motivation to change? When we're looking at the initial joint interview with family members, all the family members will be together, and the therapist or social worker will be really focused on observing the family and observing the family's behaviors and interactions, what their dynamics are, how they communicate with one another. We'll also be addressing what led to our client's hospitalization and how does the family view those events leading up. And as they're talking about the events leading up to the client's hospitalization, what kinds of feelings are coming up? What kinds of reactions are they having? What kinds of, beliefs do they have? Are they pointing blame at a specific family member? Are they not addressing something? Do they feel very upset? Are they avoiding? We'll be taking observations and notes of all those areas. Also be assessing, the level of communication and problem solving. So with this problem arising, are they coming up with solutions or are they lost? Do they have any communication skills? This might be something completely new to them. Do they have any problem solving skills? We'll also be looking to clarify patterns of behavior and, support substance use. So at the end of that meeting, I'll, let the family members know what I'm noticing. What are some takeaways that they can take? And also we'll be talking about, how they view substance use and what are the negative impacts on the family and how the family is functioning. Another area that we'll be looking at during assessment, some other options are genograms, where we can look at the family's history of substance use. Is this something that goes back many generations? We'll also be looking at psychological testing, and if the family or any members of the family have had former consultations or work with other mental health providers beforehand. And if so, it would be really beneficial and helpful to communicate with them. When talking about this family's level of care, we would say that it's severe. The client specifically has been admitted for detox and has tentatively agreed to inpatient treatment. But she's had to be detoxed and she has hit many of the different levels of the DSM-5 that would show a substance use disorder. And, in addressing the family and how the family has addressed this too, we would say that this is severe. Because the client has decided to agree for inpatient treatment, and because the family is recognizing that the client does in fact need treatment, we would say that they're at the beginning of the contemplation change for treatment because they're aware that the client has a substance use disorder and want to make some changes, but they're not really sure how to go about doing that, and may also have some fears or ambivalence about making changes. When we're looking at the family and we're looking at treatment, we have to think about which theoretical framework we're going to implement. The theoretical framework that we're going to be focusing on is behavioral theory. With behavioral theory, there's a few key things. One is that operant conditioning is a key component. Also, to talk more about this, behaviors are learned and unlearned through positive and negative consequences. So family members may actually be reinforcing negative behaviors, and family members can also reinforce positive behaviors. So, for example, a parent says a child is sick when missing school due to substance use. The parent's thought process is, I'm trying to protect my child, but really what's being communicated to the child is, if I use substances and I miss school, I'm going to be rewarded. My parent is going to cover for me, and there's no negative consequence. So this behavior is just being further reinforced. Some of the basic principles, you want to utilize reinforcement to increase positive behaviors in family interactions. And you really want to work to decrease negative behaviors in family interactions. Another basic principle with behavioral theory is really working to improve family communication and problem-solving skills. The specific intervention that's going to fall under the behavioral theory is behavioral family therapy. This is our intervention. With this intervention, the main approach is helping family members understand substance use, learn new behaviors, promote sobriety, and the ways in which they're going to do all of these things is, one, through psychoeducation. This is a big component. So one of the psychoeducation areas that they'll be focused on is substance use disorders, giving the client and family some understanding of what that is, how treatment can be beneficial, what are some ways in which they can support the family member's sobriety, and also often another key thing is parenting training, which can be really helpful for parents to learn ways to have structure and reinforce those positive behaviors and decrease those negative behaviors. Another area that is focused on in behavioral family therapy is communication training. Often, the family will be asked to participate in 4 to 6 sessions prior to working on problem solving. You can't really work on problem solving if you don't know how to communicate with one another. So this will often be one of the first tasks to work on communication training. And throughout this communication training, the family can work on how to express feelings in a positive way, and also how to express negative feelings but do it in a way that it's not harmful. They'll be working on compromising and negotiating, how to make a positive request, how to validate feelings. This is one that is really beneficial but doesn't always happen. How to effectively listen, so not talk over each other. And something as simple as asking for a timeout is really helpful. And the therapist or social worker can work with the family live, like during a session, and coach them through some of these communication skills. After the family has had some work with communication skills, the next focus is problem-solving skills training. With problem-solving skills training with either family behavioral therapy or behavioral family therapy, known as both, there's a real emphasis on consequences. So the family is going to work to first identify the problems as individuals and also as a family. So there's a lot of collaborative work happening here. They're going to brainstorm solutions, evaluate these options of solutions, agree to a plan, and then utilize contingency contracts, which we'll talk about a little bit more, but basically you do this, you get this. So if you go to therapy, you get privileges to use your cell phone. If you don't go to therapy, you don't get privileges to use your cell phone. The next step would be implementing a plan, and then of course reflecting on these results. And if the interventions aren't working, then they need to be relooked at and tweaked. In creating a treatment plan for this family, the main goal and objective is the process of engagement. How do we get the client and family engaged in the treatment process and participating in the treatment process? The first thing to focus on would be to have the family agree to a contracted amount of sessions and times. We have all these great skills and trainings to do, but if the family's not showing up, we can't do the work. So that would be the first thing. The second thing would be to have the client and family attend sessions as contracted. So with this family, we would be looking at 4 to 6 sessions in the first month, probably once a week. And we can assess that at the end of the month if they still need that level, or if they even need more, or if certain family members need more. The family will also develop an understanding of substance use disorder, of the recovery process, the benefits and mechanisms of the treatment process. And specifically, the family as a whole should attend 1 to 2 psychoeducation sessions in that first month so that they really understand the disorder and also understand ways in which they can be a support. And usually these sessions are about 90 minutes. Another goal for the family would be, or an objective too, is for the family to improve communication skills. Ways in which they'll do that is they'll be completing communication skills training. They'll utilize handouts, they'll utilize live coaching, and about 4 sessions in the first month for 90 minutes would be most beneficial. The family will become proficient in effective listening without interrupting, validating feelings, really working on non-judgmental communication, so talking to one another in a way that is beneficial and not harmful. The client specifically will be able to tell her mother when she's angry, sad, overwhelmed, any feelings that she's having, and the client's mother will be able to speak to the client without yelling at her. Those are some specific objectives. Another objective would be for the client and the client's siblings to be able to make requests without yelling, slamming doors, using any kind of physical force. The family will also develop problem-solving skills. So the family will define problems impacting the family and then rate them in terms of severity. So while there might be an array of problems, we're going to narrow it down to just a few specific problems. And the few specific problems to focus on would be access to substances. The client has been using the mother's opioid pain medication. So how do we work on that access so that she is not getting that access anymore? Another thing that's come up in the family is that the family doesn't do positive activities together. So they'd like to work on family leisure and recreational experiences. And then the other thing would be to look at is the mom's physical limitations. And, with the mom's physical limitations, she's really struggled to maintain the household and supervise the children, and a lot of that burden has been put on the client. So how can we work on that problem so that mom or someone is able to assist mom to maintain the household, and this is not put on the children specifically? Another area, family will specify concrete behavioral solutions to each problem. They'll evaluate pros and cons of each solution. So mom will lock up pain medication and engage in parent training psychoeducation. Mom will have the medical evaluation to clarify her limitations. We want to make sure that, again, the children are safe. So the mom will be able to use